Cool sculpting is the most exciting treatment that's been introduced recently. It's the only FDA-approved procedure to remove fat, modality that is able to remove fat in a non-invasive way without any of the risk involved with traditional surgery, without any of the side effects, possible complications, downtime, and so on. We apply a handpiece that draws very gently the tissue that we want to improve into it, and is then taken down to about 5 degrees of temperature, because the team at Harvard found out that once the water is mixed with fat, freezes at slightly higher temperature. So we have a natural selectivity of the water within the fat cells that will freeze at 5 degrees compared to water in different tissues that will not freeze. At that point, the water in the fat cells will expand, break down mechanically the fat cells, which once is damaged will have to be removed. I was the first physician to be trained at Harvard in this technology, and I introduced it in the UK back in 2011. Any biological tissue is made out up to 80% of water, so the water is within the fat cells. When it's mixed with fat, freezes at slightly higher temperature than normal, so it won't freeze at 0 degrees but will freeze around 5 degrees. The skin is protected, and because the temperature drops down to about 5 degrees, the skin does not get frosted, so you don't get a frostbite. The skin is very cold, the tissue under the skin made out of fat that will become hard and frozen. There will be pressure from within, because the volume has increased now by the water that has been taken to a freezing point, and that will mechanically break down the fat cell. Once the fat is broken, it's very well known that it triggers inflammatory response, which is very specific for fat, which is called apoptosis. The fat cells will then be removed over a period of time that usually take up to 4 months. You will have specific cells that will be recruited in the area, that will scan the area, find out what's going on with the area, and eventually remove little pieces at a time all the cells that cannot be repaired, in this case fat. The treatment is completely non-invasive. You do not require any downtime after the procedure. You can go back to your normal routine, you can fly, you can exercise, you can work, you can do absolutely anything you want. There are very minor side effects immediately after the treatment that in our experience last for up to 7 to 10 days. The area might feel slightly numb during this period of time, and there will be some mild superficial bruising, and you might experience some pins and needles. You won't see anything for the first 4 to 6 weeks, and after that you will start to see a very slow reduction in the amount of volume of the amount of tissue that has been treated. So it's like, you know, slowly it's living down in the area that's been treated. We have treated almost every area in the body. We can't treat face and neck as yet, but we have treated abdomen, which are the most common area, what are called the love handles, the deposit of fat on the side of your abdomen. We have treated inner thigh, inner knees, or outer thighs, the back of the calf. We have treated upper arms. We have treated breasts in male patients. We have treated deposit of fat in the back, female and male, and so on.